25-year-old Asma'u Idris is setting up this small shop in her home in the outskirts of Abuja. She and her family are exposed to malaria because of their poor living condition. Asma'u says she stayed away from the hospital at the height of the COVID-19 pandemic for fear of catching the virus.
I had symptoms of malaria last year, but I didn't want to go to the hospital because there was coronavirus. What if I go to treat one thing and come back with another, and what will happen to my kids? So I just had to buy drugs around here and take them, and I felt better.
Malaria is a disease caused by female mosquitoes found in areas with stagnant water and an unkempt environment. It often affects women and children, but it's preventable and curable. The World Health Organization says Nigeria accounts for 23% of the over 400,000 global malaria deaths recorded in 2019. For decades, the country's national malaria elimination program has been working to reduce the burden of the disease through policies and guidelines, prevention and treatment. But health experts say the COVID-19 pandemic has put pressure on those programs. This is a fumigation exercise by the Prince Nedwoko Foundation, targeting rural communities in Abuja as a way of preventing malaria.
Fumigation is one of the strategies that the Prince Nedwoko Foundation wants to use to eradicate malaria in Africa, starting from Nigeria. We'll be fumigating the streets, the gutters, stagnant water, and what have you, so that the larva that produces mosquito will be dead completely.
Experts say beyond the pandemic, the government needs to address other challenges that have hampered the fight against malaria.
The various programs that we have against malaria, roll back malaria, it should be sustainable. So when we sustain that, we have free net, we have good public enlightenment. The drugs, if they are not free, they are relatively and seriously subsidized. I think the morbidity and mortality of malaria will definitely be taken. But let's not forget to the external aspect of it. Sanitation is key. We have to go back to sanitizing the environment. So sanitation alone will go a long way into reducing malaria infestation and the mortality and morbidity that goes with it by close to 70%.
Now that Nigeria is rolling out vaccines, attention is expected to shift from COVID-19 to other life-threatening diseases. Asma'u hopes that Nigeria will get it right so that it meets the WHO target of 0 malaria cases in 9 years. Ajek Mangut, TRT World, Abuja.